I would like to invite the next two speakers. They are Jennifer and Simone. So Jennifer Katzberg, she's a clinical nurse specialist at Princess Margaret Hospital, and Simone is a social worker at Princess Margaret Hospital. And together, they lead the Adolescent and Young Adult program for patients that are 18 to 39 years old. And I think it's a very important topic that follows Nicole, talking about supporting young adults and people in the midst of their journey. So thank you for being here. Welcome.
All right, thank you. Good afternoon, everyone. My name is Jennifer Katzberg. As Katie just mentioned, this is my wonderful colleague, Simone Kurup. We also wanted to start by thanking you again, Nicole, for your beautiful account and sharing of the story of your journey, of your family. And this is a great segue as we transition to talking about caring for the adolescent and young adult who is navigating cancer. So by the end of today, we're hoping that folks feel that they understand the unique medical and psychosocial needs of AYAs. And when we say AYAs, we're meaning adolescents and young adults. That definition and that age cohort that we're talking about today as an AYA is anyone between the ages of 18 and 39. That's our definition at Princess Margaret and in Canada, but it varies across the world. For example, in Australia, an adolescent and young adult is 15 to 25. But today, for the context of the work that we do and the services and resources that we're going to share, we're speaking about folks who are between 18 and 39. And yes, we're hoping to share so that you folks can gain an awareness of AYA resources that are available at the Princess Margaret and beyond.
All right, so this is our team. So we are an interdisciplinary team made up of, we're led by our medical director, Dr. Abha Gupta, who started the program in 2014. She recognized that there was this gap in the healthcare system. Being a pediatric oncologist as well as an adult oncologist, she saw the dualities of the two worlds and then identified this gap. We have myself, the social worker on the team. We have 2 clinical nurse specialists. We have 2 school and work transition counselors funded by the Pediatric Oncology Group of Ontario, POGO. And we have a program coordinator, and we have fellows that kind of cycle through our program that are internationally trained. And we always have lots of learners on our team depending on the time of the year. So lots of nursing students, social work students, masters of public health students, and then national and international observers. So if anybody is interested in adolescent and young adult oncology care, please reach out for an opportunity to observe. All right, so as I just said, there's the pediatric oncology side of things within the healthcare system, and that's quite robust. There's a lot of resources and opportunities there in terms of programming and support. And then we have the older adult side of oncology care as well. Lots of resources and support there for the most part, but only about 6% of the people diagnosed with cancer in Canada every year are under the age of 40, so fall between the 18 to 39 age cohort. And so because of that and the assumption that you're supposed to be young and healthy during this stage in life, there hasn't historically been a lot of resources put into adolescent and young adult care. And as this slide shows, through research, we've actually been able to show that AYAs report higher levels of distress than older adults going through a cancer experience. And that's because of these variety of factors in their life. It's a period marked by intense growth and development. Think about what 18 to 39 looked like for you. Some people are still in that. There's a lot going on, a lot of things that you're still trying to figure out, a lot of pieces that are still kind of all over the place in life. And so because of that, AYAs require a really specialized lens of care. And so what makes them different? I mentioned a few things, but there is this search and establishment of independence during that time, maybe moving out of their family home, maybe moving away to school. They're the closeness to peers is typically marked by reaching milestones together, getting engaged, getting married, having children, buying a house. And so that's really important in terms of social connection, typically during this age and stage in life. There's relationship with your body image and trying to figure out what that looks like to you during this stage. And then there's identities. There's a lot of self-exploration. There's a lot of figuring out who you are, what you want to do in life, what your core values are. And then finally, particularly, we have this lens of working in Toronto, so a major city. We see a lot of newcomers, a lot of refugees that are moving to the city to try and pursue their hopes and aspirations.
Another aspect, of course, that makes adolescents and young adults different is that their biology and their bodies and their physiology is younger. They've had less exposures. So this is another thing, or another lens of looking at cancer in adolescents and young adults. It's the not supposed to time, right? Primary care, all different sectors of the healthcare system rely on our 20 to 40-year-olds to be strong and healthy. And so there aren't many resources available, but there is certainly a need. So biologically, we see more aggressive tumors. We see longer delay between symptom development, symptom onset and diagnosis, of course, because you're seeking urgent care or seeing your primary care providers or even speaking with your loved ones, people around you, and we're not thinking cancer first as any of the reasons why your body's not quite feeling the way it should. Rapid growth and development, obviously, as the body is changing, particularly when we think about the teen years into young adulthood. And this can, when we're looking at treatment and the medicines that we take as adolescents and young adults navigating cancer, there's considerations around drug metabolism. Also considerations for adolescents and young adults that tend to challenges around disordered eating or substance use we tend to see in 20 to 40-year-olds versus other age cohorts. So this can complicate ways that we approach adolescents and young adults in cancer care. But again, highlighting the need that these folks at this stage in life navigating cancer need tailored supports and resources.
So this is just a very broad overview of our program and what we do. And so as Jen said, we work with patients between the ages of 18 to 39 anywhere on their cancer trajectory. So from the point of diagnosis to when they're in active treatment to survivorship. And in 2023, so the program started in 2014, up until that point, you can only have access to our program if you're receiving your care at the Princess Margaret. In 2023, through Ministry of Health funding and the ministry identifying that there was a gap in services across the province for AYAs, we were able to open up our eligibility criteria for our program. So you can be receiving your cancer care across any institution in Ontario and still have access to the Adolescent and Young Adult program run out of the Princess Margaret. And so as you see, we see about 600 patients a year, with about 60 new patient consults a month. And we see patients from across about 28 different institutions now across Ontario.
And we'll speak about how you can self-refer, or refer on behalf of a loved one, if you have their consent, of course, or if you're a provider that is treating outside of the Princess Margaret, how you can connect your patients to resources and supports.
So these are what we refer to as our domains of care. So these are the 11 areas that our program provides assessment and care and connection in regards to. And so these were established based off of literature reviews, engaging with stakeholders, completing needs assessment and environmental scans, kind of talking to a lot of patients, families, healthcare providers, community-based organizations, and saying, okay, what's going on with our AYAs? Where do they need support? What areas are there gaps in services? And so we were able to kind of categorize them into these 11 domains. And what we want to highlight with this is just this idea of person-centered holistic care, right? You might meet them because they have a cancer diagnosis and are going through treatment, but there's so many other things going on in their lives that are impacted by their treatment. And many times, cancer is just one of the many stressors in their lives. It might not even be the main stressor in their life at that point.
Exactly. Thank you, Simone. That's so well said. And so when we look at these domains of care, we're always asking the patients, like, we are available to touch on any of these aspects of your well-being at any point along the cancer journey or trajectory as it aligns with you and when it's a priority for you. And that may ebb and flow. And we know that there are better health outcomes in their cancer care when other stressors are addressed. Better adherence, better symptom management, when we find out what is actually meaningful to them. And that can look like getting on the phone with an AYA, having a conversation with them, starting with, how is treatment going? How are you managing with your side effects of chemo? And they'll say, I don't want to talk about nausea. I want to talk about the fact that I hate the way I look because my hair has fallen. So, and this is something that they may not have had a chance to express or share in a different appointment. So another example of adolescents and young adults needing that time, needing that platform, needing that extra space to share about what's going on in their lives. Thank you. Okay, so we are going to meet Igor, and to just sort of give us an idea of how an AYA navigates through our program and how we can offer resources and also speak to resources that are available in the community that everyone can access. And even reflecting back on the stories you've heard today from the speakers, that will be helpful as well. Okay, so Igor is a 25-year-old, newly diagnosed with an adenocarcinoma of the stomach. He is preparing for gastrectomy and then chemotherapy. He is currently in graduate school and working part-time at a coffee shop. So what do we think that Igor is thinking about? So maybe Igor is your best friend. Maybe Igor is your neighbor. Maybe Igor is your partner, your patient. What is he thinking about? So we've identified, just for the sake of time constraints today, we've picked 4 domains to kind of walk through some of the questions that he may have and resources that relate to supporting those worries and concerns. We've picked the 4 domains that you see there: practical supports, fertility, sexual health, and mental health. Thank you. So, sexual health and fertility. He's 25, right? Maybe partnered, maybe not. For the sake of today, Igor is not partnered, and he is wondering things like, am I desirable? How am I gonna date? I had a patient this week who just said to me, oh no, that's not happening right now. I'm completely off all the dating apps. And I understand why, but I asked why, and he said, well, no one wants to date the cancer guy. And so figuring out the spaces to have these conversations and check in with how these folks are feeling. This is what they're wondering. When am I going to disclose what's happening, the fact that I'm going through treatment, the fact that I've had cancer if someone is in the post-treatment phase? And when it comes to sexual health, is it actually safe for me to have sex with my partner? What does that look like? I'm getting radiation. Well, we didn't just put that into the picture for Igor today, but I'm on chemotherapy. Or I've had this big change to my body. I now have a scar. Like, is it safe to engage in these types of physical movements? What can I do or not do in intimate moments with someone that I care about? So having the space to have these conversations, and it's simply asking the questions. The nurses are busy in the chemo suites. Our interactions are quick. We see our oncologists. Our family wants updates. We're not giving them an update about our sexual health, right? But AYAs are thinking about their sexual health. And this could look like simply asking the question, has anyone talked to you about your sexual health or your sex life while on treatment or since you've been diagnosed with cancer? And you don't necessarily have to have the answers. We will share at the end the QR code for our website. We've got tons of resources there. We've got webinars that have been done that talk about the psychological piece of relationships and intimacy, and then also very practical aspects of supporting sexual health, like answering the question, can I have sex while on treatment? And I will answer it right now, yes. So It's knowing what resources, knowing just one place that they can turn to, simply asking the question to acknowledge that it's something they may be thinking about, something we know our AYAs are thinking about. And then when there's an opportunity to dive deeper, is your body functioning in the same way that it was before cancer? For example, is there erectile dysfunction? Right? We know that 80% of sexual dysfunction has a psychological root. So maybe there's something deeper there with what this person is going through. Is it connecting to mental health supports? Is it that they actually need to see a urologist or connect with their family doctor about other things? Oncologists can very safely prescribe Viagra and Cipralex, 2 great drugs. But I said no to disclosures. That remains true. And then when it comes to fertility, what is going on? We have a right as healthcare providers, for those of you who fall into that category in the room, we are responsible to offer everybody a conversation about fertility. For patients and their families, you folks have the right to ask about fertility, and that can be at various points in your cancer journey. Regardless of prognosis, we need to be talking about fertility. And that also, I want to say, it doesn't matter what your sexual orientation is either, right? Whether it's the opportunity to preserve, freeze sperm, or freeze eggs, or even to do assessments after treatment, semen analysis, and other assessments to see, what's my baseline fertility? Because someone like Igor might be wondering, am I fertile? They told me that I could be sexually active while on treatment, but am I fertile while this is all happening? How do I tell a new partner that my sperm has been damaged by treatment? What does that look like for my future? And again, connecting with resources, your local fertility clinic, advocating that there's reduced storage fees for folks who decide to or have the opportunity to preserve fertility, or also connecting with the mental health resources that could relate to grief around fertility.
Did you want to know? Oh, I have this mic. Okay, so I'm going to talk about the 2 areas of practical supports and mental health. And so that typically falls under my domain as a social worker in the program. So as I said earlier, sometimes the diagnosis and the symptom management isn't even the main stressor in this young person's life at the time. It's these other things that are coming up. I often hear people say, I have a whole team of specialists that are taking care of that part of my life. I feel very comfortable and I feel very confident in the team that's working to treat my cancer. But it's the other parts of my life that I don't have a team. I don't have a bunch of specialists to help with these other aspects of my life. And I don't know what to do and I feel really helpless. So one of the things is it's a privilege to take time off of work, right? And so young people that are early in their careers, they might not have a full-time permanent job. They're balancing school and a part-time job to try and pay rent. This idea of them stepping away from work to engage in treatment, that's a difficult decision. We have many AYAs who continue to work while on active treatment because they might not have an option, or it just might be this, for many of them, it helps with their mental health. They want to feel productive. They want to feel like they're not losing that contact with that part of their identity. They've worked really hard for the job that they have and the job that they love, and they want to try and stay with it as much as possible. So as a team of the oncologists, the nurses, our school and work transitions counselors, we might work with their employer to figure out the best way to accommodate their needs while still on treatment and while still working. Another piece is someone like Igor might not have a car, might not have family members that are available to drive them to appointments, and so figuring out, okay, how am I going to get to my appointments? Parking, I think we all know how expensive parking can be at the hospital. That's also another financial strain. In the oncology world, we talk about financial toxicity of cancer, right? Like that side effect of cancer being the financial impact. And then there's this term of the sandwich generation, people that have young children, in this case Igor does not, but people who are also taking care of their aging parents. And so Igor's thinking, okay, if I'm managing school, managing work, now managing treatment, going to have surgery, going to be in recovery. Who's going to take care of my parents? Who's going to get the groceries for them like I do? Who's going to check in on them and take them to their appointments? And so trying to help them navigate these questions and talk about advocating for themselves, talking about asking for help. That's a really hard thing for these young people to do. Then on the mental health side of things, in the AYA world, we talk about this term of double isolation. So you feel isolated from your peers because many of them don't know what it's like to be so young going through a cancer experience. They'll say, oh yeah, my uncle had cancer, or my grandmother had cancer, but many of your peers actually don't know what this experience is like. And so even though you might have a lot of friends and they're checking in on you and you're still spending time with them, they're not fully grasping how unique this experience is, and that can feel really isolating. But then when you're at the cancer center and you're sitting in the clinic waiting room and you look around, more than 90% of the people in that waiting room are over the age of 40. So you're feeling isolated even within the cancer space. And then when we break it down even more, the gastric cancer within the under 40, 18 to 40 category is even a smaller population. And we will often hear from patients that they feel this sense of shame and blame in regards to the type of cancer they were diagnosed with out of ignorance and lack of knowledge of other people. How did you get that? You're so young. And even post-treatment, so they're done treatment, they're trying to integrate back into their social life. They might go out with coworkers after work and have a beer, a glass of wine, and then feeling a lot of shame and blame from people being like, you just had cancer and you're gonna have a drink. But we also know that developmentally that's really appropriate for people to go out for after work drinks at this age and stage. So trying to provide coping and counseling around the stigma that they might experience. And then, like any major stressor in life, talking about feelings that might be associated with depression or anxiety, feeling overwhelmed, feeling hopeless and helpless, going back to that isolation. Am I ever going to feel like I can relate to my peers? They're getting married, they're buying houses, they're traveling the world, and my bank account has taken a major hit. I don't know if I'll be able to keep up with them, and they're moving ahead in life, and I feel really stuck. And then inevitably, we have we're human beings, so we always go to the worst case scenarios, and we hear lots of AYAs talking about how they lay in bed at night thinking about these big existential thoughts and feelings, right? I'm so young, I have so much life that I want to live, what's going to happen? And they often feel like they can't express this to their friends and their family because they don't want to add to the burden that they already feel that they're putting on them. And so through connecting them with resources, either in the cancer center, through our program, or in the community, we try and get them connected with mental health supports.
Okay, so we're going to have some time for some questions this afternoon, hopefully still, I think. Hey, thanks, Katie. But just to kind of come full circle and offer a few key messages. So we know that within stomach cancer, only 5% of all folks who are diagnosed with gastric cancer are under the age of 40. So it's that smaller group within a smaller group, right? Which further highlights that the experience of someone young is very different than someone being diagnosed at 65 who may be retired. And we spoke about some of the reasons as to why. The good news is that we're getting to a stage, and we have for at least this stretch of the last 12 years at Princess Margaret, starting small, and now where we are today, being able to offer supports and resources and services outside of our hospital, so that regardless of postal code, if you are an adolescent or young adult navigating cancer in Ontario, you have access to specialized, tailored resources. So you are not alone, whether you are a caregiver or a healthcare provider or a family member or friend to someone who is navigating cancer as an AYA. There are supports in the community and within our AYA program at Princess Margaret. Also, for healthcare providers, we'll show a poster in just a few slides. We are offering a conference. It's going to be our third year that shares about how to offer AYA-specific care. And it's September 23rd and 24th, later on in the year. And this year, it's going to be a really exciting blend of healthcare provider-facing presenters, and then also some time for patients to hear from healthcare providers as well on topics that are meaningful to them. This is our website, and there's the QR code to our website. I use this website every day. I just always have it open on my desktop. I mean, I exclusively speak to adolescents and young adults. We have so many resources that have been put together by the experts in the various fields, like our dietitians will, or have very thoughtfully composed resources that are specific to adolescents, young adults, our mental health practitioners. So you can go by topic, you can go by those domains that we showed and think, I'm interested in sexual health, I'm interested in resources around fertility. We've got webinars, links to other community organizations that support adolescents, young adults with cancer in Canada and in Ontario as well. It's a really great resource.
Yeah, there's also caregiver resources and resources for parents who want some support on how to provide the best support to their children during this experience.
One thing that if I can mention, we've talked about resources for families and caregivers and healthcare providers. If you are an AYA yourself, we have a lot of peer connection opportunities. Twice a month, we have a virtual video call where folks can log on and be on a video call amongst other adolescents and young adults navigating cancer in Ontario, where they share stories, offer support to each other. We also have get-togethers like a cooking class, or we do a big day on the Toronto Island here in the summertime, just to bring people out, spend time together in a space where you can see other young faces who have been through something similar.
And that takes us to we have an Instagram page, so a lot of young people will follow our social media account to kind of stay in the know about what we have going on and how to connect with other people. And this is our email address, the aya@uhn.ca. So if you are interested in connecting, whether you'd like to refer someone or self-refer, or just looking for more information, an opportunity to connect with the team, possibly observe our program, you're more than welcome to reach out. We have a mailing list. We have two mailing lists. One that is patient forward, so the focus is on information for patients, and then we have a healthcare provider mailing list as well. So if you're interested on getting on those mailing lists, you can send us an email. And then as Jen said, we're very excited about our conference. That's in the Sick Kids Education Building, so it's in Toronto, and it's on September 23rd and 24th. September 23rd will be the patient day, and then September 23rd afternoon, and all of September 24th will be the healthcare provider day. So thank you.
Thank you so much for that. We have been seeing an increase in GI cancers, but in stomach cancer in the younger population for a number of years. And so we're so thrilled that you guys have this program, and hopefully we can work with you more. So thank you for that. I know that this is definitely an underserved population.